So hello everyone and welcome to the Clinical Associate in Psychology talk. My name's Liv Gowan and I'm here today with Ella G. We are both qualified CAPs and hopefully we're going to answer some questions around the CAP role for you.
Welcome everyone. We thought it'd be helpful to start with what is a CAP. So CAPs are psychology graduates trained at master's level as skilled professional applied psychologists. We work within the scope of our practice under the direct supervision of an applied psychologist. CAPs are trained to work with one population, so this is adults, which includes older adults or children. Myself and Liv are both trained within the adult sector. Within these populations, we're trained within a really broad range of settings. So we might be in a very different service. For example, I'm in psychosis, whereas Liv has worked more in personality disorder and older adults. So the vision for the CAP role is to create a new workforce to bridge the gap between graduate psychologist and clinical psychologist, developing the career pathway for graduate psychologists whilst enabling services to innovatively meet patient needs. So CAPs are a unique way to address psychology and wider mental health recruitment challenges. So this has all been taken from the Psychological Professionals Network website.
So what kind of tasks do CAPs actually undertake? This is something that we're asked quite a bit during our training, so Ella and I thought it'd be quite useful to include. So obviously just holding in mind that the CAP role can work in a variety of different environments. So this will depend heavily on which team you are placed within, but just some kind of general skills and tasks that we undertake. So CAPs are qualified to provide assessments. These can be complex assessments, formulation, and a variety of different interventions. This can be for groups or individual work, so one-to-one interventions. We also complete associated clinical notes and reports for our services. We are trained in receiving and delivering supervision, teaching and training, and offering psychological thinking in multidisciplinary teams. So I think it's important to add that there are some CAPs that are the sole psychology provision now for their teams. So really making sure that if you do find yourself in that situation, you are providing that psychological minded thinking for your teams. And undertaking service-based research, audits, improvements, and development. So this is something we'll talk a little bit more about in the presentation as well.
So what skills do CAPs hold? So this is very in line with the different tasks we undertake. There's a big emphasis on psychological formulation. So this is of all varieties. We do team formulations and we're trained in lots of different modalities of their formulation. So we've got compassion focused therapy formulation, for example, CBT, some systemic work we've looked at as well. So psychological formulation is a really big emphasis for CAPs. There's an understanding and delivering of psychological approaches, which are again really informed by our formulations. Then we might reformulate throughout seeing somebody and kind of alter that intervention based on that formulation. Reflective practice skills. So we both need to reflect personally, professionally, and then for ourselves within a supervision space to ensure that we're kind of really thinking about the work we're doing. And then we're also trained to facilitate reflective practice for teams. Communication skills, so this might be verbal and written communication skills, independent thinking, coping strategies, both for ourselves, our team members, and then also for our clients, report writing, research and audit skills as well.
So some other important things to know about the CAP role. So CAPs do work semi-autonomously under the supervision of a practitioner psychologist. So this could be a forensic psychologist, counselling psychologist, or many others. This isn't abnormal in comparison to other psychologists. All of the above will also receive supervision as well. Again, CAPs are trained to work within a specific population. So for example, Ella and I are both trained within the adult population, and then it's upon qualification that you register with that population. CAPs can utilise a range of psychological models, so it's not just CBT that we're trained in. As Ella mentioned, we've done systemic work, and we've done work in dialectical behavioural therapy, and many others, so it's not just CBT. CAPS can work in the following settings. So these are just a few of the settings that CAPS can work within. We've got community mental health, hospital wards, physical health settings, schools and colleges. The CAP role is not a stepping stone. So the CAP role is a profession within its own right, and many people work as CAPs for many, many years. It is important to note, though, as well, that for 2 years after qualifying, you won't be able to access any NHSE funding. However, if you wish to access any localised funding training, then that is completely okay. And you just need to check that with your service and the appropriateness at that time.
A little bit about the training course. So it's an apprenticeship postgraduate level 7 applied masters. The roles are advertised through NHS trusts, and then interviews are conducted by both university and trust representatives, but your employment is held with the trust. Entry requirements to get on the course was a minimum of a 2-2 undergraduate in psychology or an equivalent conversion course accredited by the BPS with relevant clinical experience in mental health settings. So this will both need to be somewhat of a breadth and depth of clinical experience. The training structure, so you're on 1 to 2 days at university per week, which includes some remote working, and then the other 3 to 4 days you'll be doing supervised practice within a clinical setting. You have supervision and support provided within your service. Part of the course is planning a research service improvement project. So that's the planning part is what gets marked within the course, but you are really encouraged to carry that out because it will help with service improvement and development. You're band 5 during training, and then once you're qualified, you move up to an Agenda for Change band 6. And then upon course completion, CAPS will join the BPS Wider Psychological Workforce Register.
So for those of you that are kind of listening and are quite interested in the role, some relevant experience that we thought might be useful for applications and also just to hold in mind if you're potentially a supervisor looking at CAPS. So some relevant experience we've got within the voluntary sector. So this could be working one-to-ones, it could be working with families, working with groups. This tends to be more within kind of charity based, so with the Samaritans and Mind, for example. And then we've kind of got the more broader terms within the NHS. So we've got workers, research assistants, assistant psychologists, support workers, STR workers, and you can see kind of a few other examples up there on the screen. I think also just to nod towards what Ella mentioned earlier, that when you're applying for the CAP role, as much as it is around kind of the experience that you have for that role and showing that you have enough clinical experience to get onto the training, it's not necessarily all about the breadth of that experience, but also maybe the depth. So it's say, for example, if you've worked as an assistant psychologist for 2-3 years in one service, that would be noted because there would be a lot of depth into that learning and those experiences that you've gathered during that time there. But yes, it's important to note, I think, just as a new role, we look at breadth and the depth.
So a little bit about my journey to becoming a qualified CAP. So I did my undergraduate in psychology with a professional placement year, which I completed in 2021, during which I had an 80-hour placement where I volunteered for an online wellbeing app supporting its users. During university, I also did agency care work. So this was paid on a really flexible time basis, supporting people in their own homes. Following university, I completed an additional qualification in level 2 counselling, which was with 3 courses in England. A really, really helpful course just to solidify some of those units within university that kind of didn't expand a bit more on more of the counselling skills. And then my assistant psychology posts. So my undergraduate placement year I was a full-time band 3 assistant psychologist in a neuropsychology rehabilitation service. And then following my degree, I worked 2 years as a band 4 in a memory and older adult CMHT service. I then did a 6-month part-time band 4 in an outpatient paediatric psychology department in Chelsea and Westminster. So to summarize, I guess, all my experiences amongst those posts, I gained a really wide range of experiences, including service evaluation, conducting psychological and neuropsychological assessments, training staff, supporting MDT meetings, research, observations, living therapy, and much, much more, but couldn't quite fit it on the slide. And then in terms of my CAP training, so I applied in 2023. This was my first round of applying for CAP posts and was accepted first time. And then I was placed in a psychosis rehabilitation service, or CREST, and then qualified in March 2025.
And just for a bit of comparison as well to show on my journey as well onto the CAP post. So you can see that Ella and I kind of have had similar routes, but maybe some differences in some areas, just to give kind of that insight to the different experiences that are relevant for the role. So I kind of first started by volunteering within psychology. So I was a wellbeing practitioner for Dorset Mind, and a support assistant for a learning disability sports club. During my undergraduate, I completed a year in placement where I worked as an assistant psychologist in a forensic setting. During my time at uni, I was also a research assistant for 3 years. So I worked on 2 separate projects mainly, one looking at the research of new OCD stimuli and another researching the impact of technology for dementia and Alzheimer's treatment. And I was also a student representative for the course whilst at uni. And I think that was quite key in kind of that training that we then go on to deliver, and kind of public speaking and things like that. I then went on to complete my master's in clinical psychology. Again, this had a professional placement where I worked as a research assistant for talking therapies. During this time, I also took the opportunity to kind of shadow a lot of PWPs and kind of see what their role was. And then from this, I went on to complete my first role as an assistant psychologist full time. Again, doing much of the similar things to Ella. So supporting in MDT meetings, delivering one-to-one interventions, supporting in group therapies, completing research, and much more. Throughout all this time, I also completed 2 additional qualifications with the free courses in England. So I completed a level 2 in counselling and level 2 in youth and adolescence within mental health. And then again, like Ella, I applied for the CAP role in 2023 and was accepted first time. I then was placed onto a joint placement, or a split placement, sometimes they're referred to. So that is within IMPACT, so the Intensive Management of Personality Disorders and Clinical Therapies team, and OPMH, which is the Older People's Mental Health Service. And then I officially qualified in March of 2025.
So if you're interested in the CAP position or wanting to find out any more information about it, we've just added some further information links here. So you've got the BPS website, the PPN. Our course provider was Bath University, so we thought it would be helpful to link to them. And then we've also developed with some other fellow CAPs a separate leaflet if that would be helpful. So you're welcome to email careers events at berkshire.nhs.uk if you'd like a copy of one of those.
So thank you very much for listening. We hope that we've answered a few questions on the CAP role for you, and hopefully this is something that sparks a bit of an interest for you. But thank you for coming along.
Thank you, everyone.